You're listening to an African Elements top news story for July 7th, 2025. Please visit our website at africanelements.org for more daily news. HIV funding cuts, a global health catastrophe? By Darius Spearman. The global fight against HIV/AIDS faces a severe threat due to significant funding cuts by the United States. UNAIDS warns of a potential surge in AIDS-related deaths and new HIV infections. Executive Director Winnie Byanyima has voiced deep concern about a return to the dark days of the epidemic. She projects a tenfold increase from the 600,000 AIDS-related deaths recorded globally in 2023. The abrupt halt of funding for PEPFAR undermines decades of progress in the global HIV response. PEPFAR has provided antiretroviral therapy to more than 20,600,000 people annually. It has also supported testing, prevention, and health infrastructure in more than 50 countries. PEPFAR constituted 60% of UNAIDS' budget. Its sudden withdrawal threatens to knock the global response off course. Estimates suggest 6 million additional HIV infections by 2029 if funding is not restored. Projections also indicate 4 million additional AIDS-related deaths by the same year. The funding freeze has caused essential HIV services to grind to a halt. Community-based organizations have lost staff and closed vital clinics. People in need of HIV testing, prevention, or daily antiretroviral medicine are unable to access care. In Mozambique, treatment and prevention efforts have been complicated by the pause in support. Grassroots groups such as Mentor Mothers play a vital role in adherence counseling and support. The loss of these roles directly impacts the mental health of those served. Vulnerable populations bear a disproportionate burden of the crisis. Eastern and Southern Africa carry 53% of the global HIV burden. Over 60% of new infections in Africa occur among girls and young women. Closing drop-in centers erode safe spaces for these vulnerable groups. The global HIV response had saved approximately 26 million lives. New infections and AIDS-related deaths had been steadily decreasing. These gains brought progress toward ending AIDS as a public health threat by 2030. In 2022, more than 9 million people with HIV were not receiving antiretroviral therapy. About 2 million further patients had not achieved viral suppression. Historical delays in sharing antiretroviral medicines cost millions of lives. Byanyima has lamented the loss of 12 million preventable deaths. The crisis is both a financial and a moral challenge. UNAIDS calls for increased and diversified funding sources. Other wealthy nations and philanthropists must step up to fill the gap. A re-evaluation of the aid model is urgently needed. Debt justice and tax justice are critical elements of sustainable funding. Imbalances in global finance have long undermined health investments. Some countries are mobilizing domestic resources to sustain priority programs. Kenya and Rwanda have reported efforts to maintain HIV services with local funds. Haiti is working on sustainability roadmaps with partners. Civil society groups are seeking alternative funding from diverse partners. Domestic efforts alone cannot fully compensate for the massive withdrawal of support. A global unified response is more critical than ever. Health must be recognized as a human right accessible to all. The progress made against HIV/AIDS must not be tragically undone. Urgent action is needed to prevent millions of avoidable infections and deaths. The world must act in solidarity to uphold the gains of the past 2 decades. The human cost of funding cuts is immense and demands a collective response. This moment calls for global solidarity and a stable, equitable system of aid. The future of the HIV response depends on shared responsibility and sustained investment. Copyright African Elements.